today's video, I'm going to share with you all about the SBAR 2. So, first of all, let me give you a little history about the famous SBAR 2 that the United Kingdom, NHS, or the health sector uses in communicating in the multidisciplinary team. SBAR, Situation Background Assessment Recommendation, is a communication tool that originated in the military and has been used in many industries. The US military developed SBAR in the 40s to improve communication on nuclear submarine for concise information where it was critical, and that was for safety as well. The aviation industry adopted a similar module to the SBAR. In the healthcare, Kaiser Permanente in Colorado introduced the SBAR to rapid response teams in 2003 to enhance safety and communication between healthcare professionals. The SBAR is now widely used to improve patient outcomes and teamwork. In care homes, the SBAR has also been adopted and used as a communication tool between care homes and emergency departments. So in short, the SBAR is a verbal or written tool that can help reduce repetition and errors and also enhance the assessment and decision-making skills. It can be especially effective in reducing communication barriers between different levels of staff and disciplines. Lovely, guys. So let's go straight into each parameter of the SBAR. The number one parameter of the SBAR is the situation. So as already defined, the SBAR is a tool that helps to effectively communicate within the multidisciplinary team to help, give information about patients and to help give the best, safe, and effective care that we can give to them. So the situation talks about, in short, what exactly is happening. What is it? So for example, let's use the OSCE mock exam. The mock scenario. Amy Hall, who has vaginal bleeding. So when you call or you make a call, or if you are, communicating in the multidisciplinary team, which in this video I'll say MDT. So if you hear me say MDT, it means multidisciplinary team. So for example, you call and you say, "Hello, my name is Vida Henson. I'm the midwife taking care of," you mention your patient's name, Amy Hall, who is gravida 1 para naught and is 38 weeks pregnant and came this morning with vaginal bleeding. Full stop. I always say to OSCE candidates that make sure that you don't talk too much. The situation is an effective tool. We want to, there is an emergency or a patient needs, review from an obstetrician or from your senior midwife or the coordinator. So you don't want to, make this SBAR so lengthy. You just want to go straight to the point. So the situation, just go straight to the point. Don't give times. Don't give, too much details, because you're going to do that in the background. So that takes us to the background. All right. So in the background, what are you going to say? You are going to go into details. Okay. So Amy Hall, my patient, who is gravida 1 para naught, 38 weeks gestation, and came in this morning this is where you are going to give the details of the situation. So she came in this morning at, let's say, for example, 8 o'clock with, history of vaginal bleeding and some abdominal pains. All right. She said she had, for example, the scenario in the mock. I have it off head because I assist, OSCE candidates a lot to train them for their OSCE. If you need training for your OSCE, get in touch. Hit me a message on my Telegram page and channel, and then we will take you from there. If you want to go by email, my email address is in the description section below. If you want to, collaborate on the email or on the Telegram channel, you can get in touch with me. So Amy Hall said she had sexual intercourse this dawn at 4 a.m. and then at 5 a.m. she had slight abdominal pain, and then at 7 she went into the toilet to pass urine, and then upon wiping she saw slight red blood bleeding on the tissue or in her underwear. All right. Then you go into details. So you are going to give example, details of hair. So here we've talked about, I've explained or I've expanded the situation. Somebody may go like, in the situation, so if I just go like, presented this morning with vaginal bleed, how is the other member of the MDT I'm handing over to going to know exactly what happened? That is what I just did. In the background, you are giving details of the situation. Okay, then apart from giving details of the situation in the background, you have to also tell whoever you are handing over to about her medical history, her obstetric history, social history, and then if there is any medication, you talk about, if she's on any regular medication, you talk about it. So in the background, you talk about everything pertaining to this patient and even when she came. So as part of giving the history of the situation, which I just did, the time the bleeding started and all that, you can add on. And this morning when she came to the hospital, a cardiotograph was done and the results was reassuring. Maybe if she had, other tests done, you talk about it. That is the situation. All right, you are expanding the situation in the background. Then we move on to her obstetric history. This is her first pregnancy at 20 weeks. If it is a second pregnancy, you can talk about, the first pregnancy, what went on, if it was a normal pregnancy, if how it ended. So for example, let's say for this video's sake, let's go like, okay, so this is a second pregnancy. Previously she had a normal pregnancy which ended in a normal vaginal delivery at so and so gestation and to a baby boy, and that baby is fine. If she had any issues during that pregnancy or delivery, you have to state it at this point. Okay, and then you go about this. For this pregnancy, she was consultant-led care because of so for example, she was consultant-led care because of her advanced maternal age. At 20 weeks she had an anomaly scan which was normal, and then at 34 weeks she also had an anomaly. So you're talking about this pregnancy, what has gone on to, that's the obstetric history. So the scenario, don't forge things. This is just a video I'm doing, and I'm trying to show you how to go about what you need to say in your background, the background of the SBAR. So read your scenario. All these things are going to be stated in the scenario for you. So you are just using the scenario to talk about the background, whatever and whatever. All right. And so I'm talking about her medical history. She is asthmatic, and so when the patient has any medical history, what I do and the tip I'm giving to you guys is that immediately you talk about her medical history. If the patient is on any regular medication due to that medical history, you can chip it in that statement. So she's asthmatic, and so she's on an inhaler. You mentioned the name of the inhaler which she takes twice daily. Okay, based on the scenario. Again, I'll stress that. Don't make up things. Whatever is in the scenario, the background, the history in the scenario is what we are going to talk about. Okay? So based on the scenario, lovely. And then her social history. So part of the medical history, you can just add her blood group. She's rhesus negative. So if she's rhesus negative, obviously she should have taken or been given anti-D immunoglobulin. So you go like, at 28 weeks, she had her anti-D immunoglobulin. Okay? Great. And then you talk about her allergies in the background as well. She's allergic to penicillin, and the reaction is so and so rashes, or is anaphylaxis. You talk about that in the background. So the background, what you're going to talk about is you're going to give details of the situation from when the concern started. For example, this vaginal bleeding, when it started, how it came about, the time and everything. Then you go about, in the background, you can talk about the background of this very pregnancy, and then if she's had a pregnancy before, you talk about how that one also went, because all of that is going to be in your scenario. Then you now talk about her medical history, her social history. Social history here is going to be, okay, she is married and lives with her husband and a 3-year-old child. You talk about that as well. Okay, and then you talk about her medical history, her blood group, her results factor, and all these things in the background. All right, then you go to assessment. So the SBAR, SBAR. So the assessment, you're going to talk about what you did in the assessment. So her assessment, if you did a top to toe assessment to her, whatever you found out, her maternal observations. So on assessment this morning, maternal observations were done. Her blood pressure was so and so and so, temperature 36.8, respiration 18 breaths per minute. Capillary refill was this was that. So in the observations, you are going to ask the assessor, because we are using mannequin. It's a mannequin that we do the assessment on after COVID, or during the COVID and afterwards. NMC UK started using a mannequin instead of real pregnant human beings. Okay, for infection prevention sake. So it's a mannequin, and definitely you're not going to get accurate temperature for a mannequin. So after you are done with your assessment station and you are ready to document or fill out your planning station or your meals chart, you confirm from the sister, can you please tell me my patient's temperature and all that. But when you get in the planning station, for example, all those informations are going to be given to you on the documents you are given or on the scenario. All right, so here in the assessment part of the SBAR, as I was saying, so you mentioned all the maternal observations you did, and if you did abdominal palpation, you talk about it. So on abdominal palpation, standardized fundal height was this centimeters, baby lie was longitudinal, presentation was this, position was this and that. You're going to talk about all of that in the assessment. Okay, and then on assessing her perineal pad, there was still some slight red blood loss in the sanitary pad. So everything you did about her assessment, you are going to put it in there. On fetal auscultation, you know that a pregnant woman has a baby in utero. So apart from assessing the mom, you are going to assess the baby as well. Or let me say the fetus. Let's use terms, okay, professional terms. So on fetal auscultation, fetal heart rate was this, rhythm was fine, everything was reassuring, no concerns. You talk about that. Do you get my point? So everything you did, all the assessment you did on the woman and the baby, you are going to talk about in the assessment station. Even though differential diagnosis or diagnosis is not part of the SBAR acronym, you have to give differential diagnosis or your diagnosis before you move on to recommendations, because your recommendations are going to be based on the patient's diagnosis. Am I correct? Sorry. Am I clear on what I just said? So right after your assessment, remember to put your differential diagnosis and your diagnosis. Most of the candidates that I have trained or helped in their OSCE preparation, whenever they get to assessment, the next thing is recommendation. They always forget to put the differential diagnosis. And so I asked, so this recommendation you are giving to me, what is it treating, or what diagnosis is it managing? So make sure you talk about the differential diagnosis. Let's say, for example, for the purpose of this video, as I said, we are using the mock vaginal bleeding. So you can give a differential diagnosis of vaginal bleeding at term, or a diagnosis of vaginal bleeding at term, or based on your assessment. If you did urinalysis and you had leukocytes in it, you can give. So your diagnosis can be vaginal bleeding at term, and then your differential diagnosis can be urinary tract infection. All right. So you know that here your recommendations are going to be based on these two diagnoses that you've given. So number one. So what I always say to candidates is that on the meals chart, if you after filling out your meals chart, you are going to know whether your patients. I've done a video on filling out the meals chart, so find it in my video portfolio. You'll find it here on my channel. Okay, so that is it. So find it and then watch it. Okay, so what I always say to candidates is that in your recommendation, you are going to get some recommendations from the meals chart. So the front page of your meals chart gives you recommendations for whatever the patient's observations were. So if your patient triggered anything on the meals chart, when you send the front page of the meals chart, you're going to get recommendations there. So you can talk about frequency of patients' observations. So you put those recommendations per the findings of your meals chart, and then specific recommendations pertaining to the differential diagnosis you've given. So if it is vaginal bleed, the patient is also results negative, you take blood, you admit the patient, take blood for grouping and cross matching, all the blood tests that you have to do, you use a needs, LFTs. Make sure you don't use acronyms in your OSCE test. User needs is urea and electrolytes. LFTs, liver function test. So if the patient is results negative, what is, because there can be sensitization with this mock scenario, the bleeding. If the patient is results negative, you put that there. And then and what I always say to candidates is that whatever recommendation that you are giving, make it in 2 clauses. Okay, so ask for obstetric or escalate to senior midwife and obstetrician for obstetric review immediately. Why? So the next clause is going to be for a possible speculum examination due to the vaginal bleeding. Do you get me? So make sure that your recommendation statement is always in 2 clauses. So let's say, for example, if the patient has ruptured membranes at term and your diagnosis is established labor and there is meconium stained lico, so why do you need the obstetrician to come and review the patient now? It's because of what? The secondary to meconium stained glycol. Do you get me? And then, so you put your recommendations pertaining to the scenario you have been given, or the scenario you got in your test. Is that all right? And then there was this thing that I wanted to say. So whilst you are reading through, to help make it easy for you to get recommendations or plan for your patient's management, when you are reading through your scenario, okay, and during your assessment, as you assess your patient, look for 2 main problems that you want to solve or manage. So if the patient, for this scenario, Amy Hall came with pain, all right, abdominal pain. So number 1, we found a problem there. So we are going to, solve that. So what recommendation can you give to solve the pain? Offer pain relief. Do you get me? It's one of the recommendations you can give, okay? And then encourage mobilization and, position change, deep breathing exercise. So that is a recommendation you can give to manage the pain. And then she was also bleeding. Amy Hall is also bleeding. So what can we do? Another recommendation is that, escalate to the obstetric team, or you can put the statement, escalate to the senior midwife in charge, plus the obstetrician for obstetric review immediately for what? Possible speculum examination due to the vaginal bleeding. And then this also, you can also say that continuous cardiotocograph monitoring because of the vaginal bleeding, to make sure that the baby is fine. Do you get me? So whilst you are assessing your patient and while you are reading through the history of the patient's situation, you have to make sure you find out 2 or 3 problems you would want to solve, and that will make it very easy for you to give your recommendations in the recommendation aspect. And remember, after you've done your SBAR, if it is in the planning station, remember to sign, write your name and the date. If it is in the assessment station, you know that it is just verbalization you are handing over. So one aspect of the assessment station marking criteria is that you are able to hand over to the MDT, which is your assessor. So anytime you are going to hand over or communicate about your patient to another member of the MDT, you have to use the SBAR, whatever, irrespective of whatever clinical skill that you are doing. So if it is API station, if it is the assessment station, planning or evaluation, if it is postnatal sepsis, whenever you have to hand over anything about your patient to any other member of the MDT, use the SBAR approach. I hope this video helps you to pass your midwifery OSCE, and this also pertains to nursing. So SBAR is used across the health sector in the UK. So use the SBAR well, and you are sure to pass your exams. I wish you all the best in your OSCE exam, and until we meet again in my next video, it is take care of yourself and success in your exam. It's just been greatness.